Every 5 minutes, at least one person in the US will die from an opioid overdose. But overdose can be reversed. Naloxone is a medication that temporarily reverses opioid overdose. Opioids are drugs that alter the body's perception of pain and can cause sedation and euphoria. Fentanyl is a very strong opioid. Sometimes fentanyl is found in other drugs. When someone takes too much of an opioid, they become unconscious and their breathing begins to shut down. If an opioid overdose is not reversed, it's likely that this person will stop breathing and die. That's why it's important to give naloxone quickly. Naloxone is safe to use even if you don't know what someone has taken or why you can't wake them up. You may notice cool, clammy skin, blue or gray lips and fingertips, and snoring or gurgling sounds. If you think someone may have overdosed, try to wake them up. Ask, "Hey, are you okay? Can I try to help you?" Try to shake them awake. If they don't wake up, check their breathing. If they're breathing less than once every 5 seconds, if you see their chest or belly moving only a little, or if they're not breathing at all, explain loudly and clearly that you're going to give them naloxone. If someone else is there with you, they can call 911. If you can, roll them on their back. Peel back the foil on the package and remove the nasal spray. Hold it with 2 fingers on either side of the nozzle, but be careful not to press the plunger yet. Gently insert the nozzle into their nostril and press the plunger all the way in until it clicks. This releases the entire dose. To prevent choking, roll them onto their side with their knee and their elbow out in front of them. If you're alone with the person who's overdosed, now you can call 911. Remember that someone who has overdosed may be breathing slowly or shallowly. If they're breathing less than once every 5 seconds, or you see their chest or belly moving only a little, rescue breathing is essential. First, make sure nothing is in their mouth. Then, roll them onto their back. Place a rescue breathing barrier mask if you have one. Tilt their head back and lift their chin. This opens the airway to allow your breaths to go in. Pinch their nose closed and give one breath slowly, watching to see their chest rise. Continue giving one breath every 5 seconds, and be careful not to give breaths too forcefully or too frequently. If you hear gurgling sounds or they start to breathe deeply on their own, stop and roll them onto their side. Naloxone takes 2 to 3 minutes to work, so it's important to wait before giving more. If they're not breathing effectively after 3 minutes, it's time to give another dose. This time, you'll use the other nostril in case the first one was blocked, but everything else is the same. Peel back the foil, put it in place, and press the plunger. Then resume rescue breathing until the person begins breathing effectively on their own. Remember, this means they are breathing deeply and at least once every 5 seconds. Most overdoses can be reversed with just 1 or 2 doses of naloxone, but if there's no response, keep giving rescue breaths and make sure to wait 3 minutes between any additional doses. Once they are breathing effectively, the overdose is reversed. When people wake up after an overdose, they may not know what's going on. Take a step back and explain. "I couldn't wake you up and you weren't breathing enough to stay alive. I think you overdosed, so I gave you naloxone. I'm here to help, and I'll stay here with you to make sure you're okay." If this is someone who uses opioids regularly, they may be in severe opioid withdrawal and in extreme pain. They may want to use again. Let them know that they'll feel better when the naloxone wears off. If they refuse medical care, try to have someone they trust stay with them for the next several hours or overnight. Try to make sure that person has more naloxone and knows how to use it. Carrying naloxone with you and being ready to give it is easy. You just learned how in less than 5 minutes. But we still have so much work to do to end this public health crisis. So thank you for taking the time to learn how to use naloxone. Thank you for carrying it with you. Thank you for being ready to extend life when someone really needs your help.